Good afternoon, everyone. I'm aware that this has been a very long day and I'm at almost the graveyard shift, so I will try to be a bit dynamic and keep you awake, because I know it's hard to concentrate on a day like this, particularly when the subject matter is quite heavy. As this slide says, I'm Michelle, and sometimes I struggle to know how to introduce myself, because I think before I had children I was very clear. My identity was very much tied up with being a psychologist, because I guess your work is such a huge part of your life. And I wonder for you guys whether kind of being a midwife will become a huge part of your identity as well. But since having children, I think my identity has really been called into question. And I think particularly that first year after Orla was born, and I was a mum, but I didn't have a baby. And sort of knowing, am I a mum, or do I have to say that I'm a bereaved mum? It was a really confusing time. But anyway, I think I can safely say I'm a mum to two girls, and I'm also a psychologist. I don't know, do many people know what a clinical psychologist is? Yeah? Anyone know? No? Some shake your heads. So maybe I should probably clarify that, which is quite hard to do in a couple of minutes. So a clinical psychologist is someone who trains in psychology to doctorate level, and basically you're trained in the whole broad spectrum of mental health difficulties. So trained in understanding what those mental health difficulties are, why they occur, and best practice and treatments for alleviating those. So we're trained in talking therapies. We're not trained to administer medication. We're trained to learn how to identify and assess people's needs, and to offer therapies and interventions that will hopefully help people to live lives that are kind of less impacted by their mental health. And I've been doing that for 15 years in the NHS, so I feel like I have some kind of understanding of some of the pressures that you probably are starting to learn about in your training, and what it is to work in a service that is under so much pressure. So I'll sort of try and hold that in mind as I'm talking today. I also blog, and my new blog name is called From the Other Chair. It used to be called Dear Orla, which was a nod to the letters that we wrote, my husband and I wrote to Orla in the year after she was born. And From the Other Chair is a bit about me sitting in the other chair, not as a therapist, but as someone receiving therapy, which is something that happened after my second daughter was born. So today I'll be talking a bit about me and my life personally, and a bit about my personal life, because I think these two things are the things that collided, I think, when my world fell apart, when our daughter died, and everything that I thought I knew about mental health completely shattered. I really thought I understood what trauma, what grief, what loss was. And then when I was actually faced with it, I realised that I knew nothing at all, that what I knew was really quite two-dimensional. It was stuff that I'd read, and there's something so tangible and powerful about really experiencing that. And that's not to say that you can't be a good psychologist if you've not had mental health difficulties yourself or suffered trauma. In the same way, I'm sure that you can all be excellent midwives having not given birth. But it does give you a different dimension, I think, if you've actually had lived experience of what that person's been through. So this is us. On that side is that's me and my husband and our daughter Orla. And Orla was stillborn at 37 weeks in May 2016. It was a completely textbook pregnancy. There was just, absolutely everything was perfect. I was actually heading towards a home birth. I was being looked after by an excellent midwife in a case-loading team. I felt really supported. I'd done hypnobirthing. I was not scared of labour. In fact, I was really excited for it. I really was something that I was quite intrigued about how it was going to unfold, but I think I really thought that I was equipping myself with all the skills and knowledge that I needed to be able to bring my baby safely into the world in a really calm, containing, confident way. I had no idea that you could have such a wonderful, happy pregnancy and get to the final hurdle when your baby is full term, for someone to turn around and say, I'm really sorry, but your baby has died. And not only has your baby died, but you're now going to have to go through labour and birth that baby. And this was something that I had put on this pedestal, that this was going to be this wonderful, empowering, exciting experience, and yet that was kind of really taken away from me as well. So not only was I stolen of my baby, I was stolen of everything that I'd sort of prepared myself to have up until that point. Nevertheless, giving birth to Orla will always be one of my proudest experiences. It wasn't a natural home birth. I had all the drugs, I had the epidural, and I'm not ashamed to say that I had that, because actually it really helped me to get through something that was really, really difficult emotionally. And she arrived, and I'm ashamed to say that I was quite scared to see her when she was born. I was scared as to what she would look like, and I was really scared about how I would feel about her. I remember sort of vividly having my eyes closed and thinking, there's no way I want to see her until someone can tell me that she's okay and it's safe to see her. But of course, once I did, I didn't want to let her go. On this side, this is our cheeky daughter, Esme, our second daughter, and she arrived 11 months after Orla, so we actually were lucky enough to fall pregnant quite quickly. And as Jess spoke about before, that pregnancy was incredibly difficult. It was so stressful. It was terrifying, and it just felt like walking on a cliff edge for 9 months. Every single moment of every single day thinking something's going to happen and I'm going to fall into the crevice and I'm never going to get back out. And whilst I think lots of people can find hope after baby loss in many different ways, for me, I guess I'd pinned so much on having another baby that it just felt like if I lost this baby, that would be, I would not be able to get myself back out. That would be the end of me. And that's quite a tricky path to lead, really, the sense that, okay, I've survived the worst thing, but actually there possibly is an even worse thing to happen. That would be losing another baby. So that's sort of really tiptoeing on the edge of completely falling apart. So as I said, our pregnancy was happy, healthy, no problems at all, and Orla was born at 37 weeks. I put that photo up there because it was taken about 6 weeks after Orla was born. And I look at that photo, I don't know how clear it is really on there, but I can just look at that photo and see how glazed my eyes are and how I think I just look like an empty shell behind them. And I think for me, when I look at that photo, I find it quite painful because I think it just kind of captures this complete desolation and emptiness that I felt. That's not the Michelle that I knew before. It's someone who was something had been scooped out of me when my baby died. And I was just an empty person who was just about holding it together. And of course, those kind of early months are really, early weeks and maybe even months are sort of characterised by lots of kind of numbness. So that's quite normal, but I do still find that quite a painful photo to look at. Now, like I said, for me, it was I became so focused on getting pregnant again that grief was kind of there, and it was it was humming away. I was kind of living and breathing grief for those few months. But I was really lucky that I did get pregnant again quite quickly. And I kind of think, I wanted to say, I kind of plodded along, but I don't think I plodded along. I think I galloped along. It was like, I need to get pregnant again. I need to have another baby. And I also did lots of stuff to try and distract myself from how awful that felt. So doing lots of things like blogging and fundraising, and I went back to work after 6 months. And 3 of the months that I was off, Andy and I went to America, and Andy cycled down the length of America to raise money, and we kept ourselves so busy. And I think that it was this busyness that kind of helped just to kind of hold me together, because I felt like if I actually sat with what was going on, I was going to crumble and fall apart. And it was really reinforced. People were going, you're doing so well. You're doing really, really well. You're being really brave. You're being really strong. And I think I just started to believe that. Like on the surface, I was like, I'm doing this really well. I've got this grieving nailed. I'm doing really, really well. I wasn't. I was spoiling the end of the story. I really wasn't. But I really thought that I was. And, you know, we went through pregnancy after loss, which was really difficult, and I think Jess captured the essence of that perfectly, because it was, I mean, it's just so difficult. And at the end of it, we had a healthy baby. She was induced at 37 weeks, or just a bit more than 37 weeks. And she came out screaming, and she was fine. And we stayed overnight just for one night, and then we went back home the next day. And suddenly I had a baby to look after, and I couldn't do all the things that I was doing before, and I couldn't do all the blogging, and I couldn't do all the fundraising, and there was a lot of time, there was a lot of being and sitting with a new baby, and having a baby that really needed lots of me, and actually there wasn't a lot of me left to give because everything had been kind of sucked away. I sort of carried on for a few months, and I kind of thought, well, maybe this is normal motherhood. I'm really tired, I'm really stressed, I'm really overwhelmed, but everyone says it's hard. Everyone's talking about how hard it is. There's this really great kind of narrative out there on social media at the moment that, you know, motherhood's hard, don't let anyone say that it's not. But I just, you know, I do think that kind of perpetuated this idea that this was normal, and for me it wasn't normal. So it got to Esme was about 6 months, and I just thought, you know what, I don't think this is normal. I don't think I can hold this together anymore. For 6 months I'd kind of tried to kind of keep going, tried to keep doing the things that I was doing, but every day felt like I was walking through treacle. And it was so hard because there'd been so much support around pregnancy after loss, and there'd been so much excitement and then so much relief from everyone, I think, when that baby came out. When we had Esme and we were like, oh great, we can take her home, I think everyone just kind of like breathed a sigh of relief and like, well, that's it now, you've got your happy ending and everything's okay. And yet I didn't feel okay, and the shame and the guilt that I felt for not feeling okay, because I had my happy ending, I had a baby, this was everything that I'd wanted for such a long time, and yet I still felt like that person who was glazed, you know, had the glazed eyes and looked really empty. And that was a really difficult realisation for me, that having another baby doesn't fix everything, doesn't take it away. So I thought, you know, I don't think this is normal anymore, so I'm going to go to the GP, I'm going to go and speak to them. And as you can imagine, that's really a really difficult thing to do, to kind of go in and say, oh, I don't think I'm feeling okay, I don't think this is right. But as a psychologist, it's even harder, because there's this sense that, well, I know this stuff, like, how have I not been able to fix myself? How have I not been able to keep myself okay? And that's sort of the, you know, that added guilt and added shame, and thinking, well, what are they going to do with me if I do turn up? Like, where are they going to send me? I think what, for me, actually, let me just jump back and finish that bit of the story. So I went to the GP and was referred to, the GP was lovely, and the GP referred me to perinatal mental health services, and I was, a few weeks later, a nurse came out to see me at home, and she stayed working with me for about another 6 months, maybe even a bit longer. And I also saw a psychologist and had some therapy as well. And, you know, the support that I got was really good. And, you know, I suppose their kind of conceptualisation of it was that I had postnatal depression. The reality was that I think that's just kind of one label. What happened really was that someone had pressed pause on my grief. Probably myself. I'd pressed pause on my grief to get through pregnancy after loss. And then suddenly everything kind of came at me like a big tsunami. So everything that I hadn't processed before, just, you know, I had the space for it to kind of leak in and really kind of floor me. And I suppose, I'm guessing with some of the lectures that you have, you have some lectures about kind of postnatal care, postnatal depression, mental health. It's a really vulnerable time for women anyway. So, you know, the likelihood of you developing depression or anxiety or OCD is really quite high in the postnatal period. So if you think that that is the case for, you know, kind of the average population, if you add loss into it, think about all the things that someone's going through, all the grief that they have been carrying, but also all the stress and anxiety of their pregnancy, then their risk is inevitably going to be a lot higher for developing some mental health problems after in the postnatal period after another baby. When I realised that once Orla had died, and also once I realised that I was really struggling, kind of just really got me thinking about, gosh, like I've been a psychologist now for 15 years. I've worked with a lot of women. You tend to see more women than men often who present for therapy. But also for the last 5 years, I've been working in a service with parents, mainly parents who are at risk of having their children removed. So I work in children's social care with parents with complex mental health difficulties. But I just kind of kept thinking, I must have worked with women who'd lost babies. Like, this happens to so, you know, all the statistics are saying it happens to so many women. How come I'm struggling to bring to mind any women that I've worked with that have lost babies? And how come I can't bring to mind any training that I've had about how to help women psychologically who've lost babies? You know, I've done years of training. I've, you know, sat in lectures for you know, like you guys, for hours and hours and hours, and not once can I remember ever being told about this. And yet, what I've kind of experiencing in my personal life, and now what my eyes have been open to, is that this is a real risk for women, and there aren't healthcare professionals out there who are recognising this maybe, or picking it up. You know, our GPs trained to kind of know about the difficulties. And I suppose what we're seeing is that charities often kind of pick up that emotional, I don't want to say burden, but, you know, they're picking up the emotional needs of parents, because it's not, I just don't think it's been given the time and the research that it deserves. I searched for ages to try and find a photo of me at work, but I don't have any, and I mean, it's probably, me at work just looks like a scruffier version of me today. So I just thought I'd just try and find a cartoon. I liked this one because I just kind of thought, well, often this is what therapy's about. Like, I'd like life to be a bit less intense. I'd like it to be less of an emotional roller coaster and a bit more of a teacup ride. And I think most people who, you know, present to services are you know, very much that's what they want. But I did find myself becoming quite self-critical, kind of thinking, gosh, you know, I must have seen these women. Did I even ask them? Did I, you know, acknowledge what they've been through? And did I do enough? Because, you know, I so desperately wanted to know and reassure myself in my mind that I had done enough for these women. And then there's something about, do you ever use genograms when you're doing some nods? Yeah. So for those of you who don't, it's like doing a family tree. So you might be sort of assessing a person or a family, a woman that's coming into your clinic, and you want to know sort of who's in their family, how many children there've been, where do they fit in the birth order, and the different symbols kind of relate to different people. So a square is always a male and a circle is always a female. And I don't know why, but this kind of kept coming to my mind. I was like, how many genograms have I done, and how many times have I drawn the triangle? Because the triangle represents pregnancy and crosses through them in certain ways. I mean, there's lots of different types, I think, of crosses and lines and things that you can do. But I just kept thinking, how many times have I done this, and have I given it the focus that it deserves? Because, you know, are there some mums that I've drawn a lot of triangles for? You know, how many mums that have I worked with who've gone through multiple losses, and did I really understand that within my kind of broader understanding of what their difficulties were? And I don't ever know, but I know that I will ask that a lot more in the future. And I think it's just important to kind of think about some of this stuff. And I suppose, I mean, someone who might use these things in your work, but I think it's always a really useful way of drawing out a woman's journey. It's like, how many pregnancies has she had, how many children has she had, in what order? Because it will help you build a really good picture of, okay, there's multiple losses and they've occurred, you know, in a cluster here, and it might help you to understand kind of what's going on for them right now, and why this pregnancy maybe is a lot more difficult. You know, maybe they found out that this pregnancy is a boy and they've always lost boys previously, or, you know, I just think it's a really useful tool. Anyway. In terms of my training as well, the one thing that I kept also coming back to was grief. And what did I know about grief, and what training had I had about grief, and how helpful was that? And I think probably most of you have been told about the stages of grief and what that means, and that you go through certain stages and somehow you come out the other end a well-adjusted, stable human being who's functioning in a really healthy way, and you've packaged up your loss and you've kind of moved on. Which of course most of us would say that's not actually true, and grief kind of goes on forever. It kind of changes in its kind of manifestation and how it affects you, but it's there all the time. And I think actually to give it its due, when, I can't remember who it was that developed the model, but they actually didn't mean it in a sort of stage, stepwise model. I think the people who developed it get a lot of flack for this, and I don't think that's how they actually meant it. What they meant was that there are key tasks that happen when you grieve, and that those tasks might go in that order, they might not. You might skip some of them, you might go to one and then go back to the other. So it's not actually meant in a stepwise way, but it's quite a helpful way of understanding some of the core tasks of grieving. And this was something I remember sitting in lectures on, and interestingly the lectures that we did have always fell within our older adult teaching. So this idea that grief occurs when you're old, because that's when you die, is when you're old, and when you're old all your friends die, and that's when you need to know about grief. And I was just like even as psychologists, we are perpetuating this idea that you only die when you've lived a nice, long, healthy, happy life. Not that grief and loss occurs sometimes at the beginning of life, or before life even begins outside of the womb. So I've gone through my own sort of stages of anger, I think, towards grief and what I know about grief. But I think this, probably most people have seen this doing the rounds on social media and online, that grief is messy. It's really tricky. You kind of go from one to the other, and it kind of looks a bit angry and angsty, because that is what grief is like. It's confusing. It's completely all-encompassing. And it's really physical. Lots of you here have probably experienced grief, maybe not baby loss. But I think for me, what I was so surprised about is how grief is such a physical experience for people. And if you think about grief occurring in the context of baby loss, baby loss is a very physical experience. And I think I found that quite confusing, that what is a kind of normal physical response to having just given birth and, feeling a bit kind of empty, wobbly, sort of jelly-like, and how much of this is grief. And it was such an overwhelming experience that it was quite suffocating, because I just wasn't sure what was what. And maybe it didn't really matter, but I think it's really important for you to know that that can be a very confusing time for women, that they're going through something very physical in terms of their physical well-being, but also emotionally. So one of the things that I just wanted to kind of think about with you today was I could talk about mental health and things for hours, because that's what I live and breathe and have done for a really long time. But I suppose what I wanted to think with you guys about is, when does grief, which is a normal expected response in the context of a terrible situation where a baby has died, or anyone has died, or that you've lost something or someone dear to you, when does that go from being normal grief to something that actually is a bit more than that, something that requires more of an intervention? Because ultimately, grief will, there's no pill for grief, there's no treatment for grief. You can't get rid of it. It's something that you have to go through. It's a process. It's something that as humans we have evolved to need to go through in order to kind of make sense of something that has happened. But actually, so often, lots of things get dismissed as grief, and they're not grief. There's something a lot more, and they're actually having a really, really detrimental impact on someone's life, and they need something additional. And I think you guys are probably in a really critical role, I think, in identifying some of that, because you're going to be seeing women maybe postnatally for a period of time who may be presenting with some complex mental health needs. And if you're caring for them in pregnancy after loss, and that kind of postnatal period after taking home a baby after loss, I mean, they're hugely vulnerable critical periods. So I think you play a really, really important role in managing, and well, I think identifying someone's mental health difficulties. Might not be your job to do anything about it apart from signpost or refer on. But I just think that, in fact, actually, it's probably one of the key roles is getting someone to the help they need. This model I find really, really helpful. I mean, it was actually developed to think about psychosis and why someone would develop a diagnosis of psychosis. But I think it's just a really, really helpful way of understanding why some people might develop a mental health difficulty and some people won't. Because, you know, I'm sure you're all very fully aware of this, but we could all develop a mental health difficulty. No one is immune to this. It could happen to any of us. But the idea is that if we have lots of vulnerabilities, so a vulnerability might be previous trauma, it might be previous mental health difficulties, it might be experiencing current crises in our lives, it might be having a family sort of genetic loading of mental health difficulties. If we have a lot of those going on in our lives, we might have our tolerance level for stress is going to be a lot lower than someone who doesn't have that many vulnerabilities. So I guess what we would be asking you to look out for is when you're sort of booking women in, how many sort of levels of vulnerability do they have? I know when I've had my booking appointments, there's some questions about, do you have any mental health difficulties? I know I was asked about domestic violence. But, you know, sort of picking out, are there other things that could make someone vulnerable to developing a mental health difficulty? And of course, I would say losing a baby is one of those. It's a hugely traumatic event. And obviously the more losses that someone's had might mean that they are more vulnerable. So, and obviously pregnancy and having a baby, it's quite stressful. It's quite stressful being pregnant after us. It's very stressful taking a baby home, I've since learned. So, you know, we need to think that if you can sort of just keep, if the one thing you take from today is just keeping that model in mind, is think about what are someone's vulnerabilities and that they are in a very stressful situation, so that they are at risk of maybe developing something like anxiety or depression or OCD or, you know, any sort of any part of any type of mental health difficulty. There's research out to suggest that 4 in 10 women who've had a miscarriage will experience symptoms of PTSD. Now, that's quite high, I think. 4 out of 10 women. And how many women do you know of that have gone through miscarriage that you see? And how many have had multiple miscarriages? Because that would probably increase the likelihood of them experiencing PTSD. There's also evidence to suggest, or research shows, that this anxiety that people experience after a loss can continue for years, and there's no evidence to suggest that it ends with the birth of a healthy baby. So this idea in society that we have that there's something kind of restorative and fixing about having another baby and bringing them home is actually a lie, and it's an unhelpful way of approaching women who are going through pregnancy after loss. But I guess the question, and I think the question probably for you guys, definitely for me when I was going through it, and I think for mental health professionals as a whole, is what is going on for this person, what's going on for this woman or partner. Is it grief? Is this normal and, you know, an expected experience after someone's lost someone? Or is it something more? Is it something that they actually need some specialist help with? And I don't think that's an easy question to answer, because I think they overlap. Because if you develop anxiety or depression, it doesn't take away your grief. Your grief will still be there. It's just that it's kind of manifesting and mutating and becoming something else, and there's kind of more layers of other things kind of being put on top of it. So it is a really confusing picture, and that makes it kind of hard, I guess, sometimes to know where to send someone. I think the important things, I suppose, are to hold in mind are that bereavement counselling, for example, is, you know, obviously a very helpful approach to helping people process grief. But bereavement counselling won't treat PTSD. It's not an evidence-based treatment for PTSD. There are other things like EMDR or trauma-focused CBT that will target diagnosable PTSD. And equally, you know, sometimes people's grief will become so huge that they will become depressed, and they may need medication, for example. And of course, medication won't necessarily get rid of grief, but it might help someone to kind of manage some of those really intense emotional and physical experiences that come with depression. I think the thing that I always hold in mind is that up until not that long ago, bereavement and grief was actually an exclusion criteria for being diagnosed with depression. So if you presented at your GP and you'd lost someone and you were going through the kind of grief process after a loss, that very often people would be told, well, you're grieving. That's kind of, that's how it is, you're grieving. And then people wouldn't get the support that they needed, and they might go, they might be lucky enough to be signposted to some counselling, but they wouldn't necessarily get the targeted intervention that they needed. And that's actually been very much recognised, and it's now no longer an exclusion criteria. There's also another, although I say grief is not a diagnosable mental health problem, there is something that's become known as complicated grief, which is when grief becomes quite protracted and impacts on people's quality of life and their ability to function. And the interesting thing that I've read recently is that people who've lost a child, lost a baby, are more likely to fall within that criteria. So there's something about baby loss that is really, really quite intense and really quite serious. Now, of course, I'm guessing that you guys probably see lots of people who have all coped quite differently, and you might have cared for women who've had multiple losses who seem to really kind of be doing actually okay, and some who maybe have had one loss and really aren't doing okay. And there's no rhyme or reason about why one person will need more than another. And I suppose don't be fooled into thinking that just because someone has had maybe one loss and it was earlier on, that their needs are going to be much less than someone who's had a later loss. I think it's just really important to hold in mind that any loss can have an impact on your emotional well-being. I mean, we could, there's so many reasons why people cope differently. I think we all have different personality and personal coping styles. Of course, different people have different kind of levels of resilience. And when I say resilience, I actually very strongly believe that resilience isn't something that someone has or doesn't have, and it's not something that's an individual task. I think resilience is something that is grown and built within the networks and the systems that we exist in. It's not something that you say, well, that person's really resilient and that person's not, because actually you can build resilience with the right factors and support around you. I think there'll obviously be sort of cultural differences in how people cope, and obviously people who maybe went through loss years ago, there was societal differences about how we spoke about baby loss. I suppose the other thing to kind of keep in mind is also what support do people have available, and do they have other things going on in their lives? So going back to that previous model of what's their vulnerability, are there other traumas and losses that they've gone through that aren't baby loss that you need to hold in mind? And I think it probably goes without saying that someone who has previous mental health difficulties may be likely to, more likely to develop another mental health difficulty in the wake of loss and pregnancy after loss. That's not to say they definitely will, but it's definitely a risk factor. But I think the key thing to remember is that responses to loss and trauma can be delayed. I think if, this is no criticism of my midwife, because she was phenomenal, but I didn't help her identify that I was struggling, because I was kind of like, I'm all right, I'm doing okay. So sometimes, just asking more questions, taking it slowly, sitting down with someone and really understanding, are you really okay? Like, how do you really feel? What's going on? If you're going through something really difficult, it's okay to not feel okay. Because it's very easy to kind of not want to go there, and I think it's important to remember that just take your time, because appearances can be deceiving. So in terms of what helps, I think I said earlier that I guess your role often will be identifying and signposting and getting people tapped into the right support. You're not going to be there to offer therapy per se if someone has got more of a mental health difficulty like antenatal or postnatal depression or anxiety. But the things that we know that can help, so with grief, bereavement counselling, with more complex mental health difficulties, specialist therapies and medication. I didn't put that on there, but obviously medication can help, and I guess there's lots of evidence out there to suggest that lots of medications are safe to take in pregnancy, and I think that's really important to have that conversation with women who are often petrified of taking medication in pregnancy, let alone taking medication in pregnancy after loss. Asking the right questions, signposting, and connecting with other people with similar experiences. So I have to say, I wouldn't have got through the last 2.5 years if it wasn't for the people that I'd connected with. And I know everyone is different and not everyone wants to kind of connect and find other people, but certainly if it wasn't for these women, I don't know if I'd be standing here having this conversation now. So I might have covered some of this, but I think, the important thing is that in terms of mental health in relation to baby loss, midwives, I think, play such an important role about identifying, talking, checking in, normalising people's experiences, but also being really aware when the balance tips. Grief is normal, all of those feelings are really normal, but sometimes they'll tip into something, and I don't want to use the word that's not normal, but something else. It'll be something bigger. And I think if you take home one sort of core message, it's that grief and mental health has no time frame. So being able to communicate to women that if you ever feel like things aren't right, this is where you can go and ask for help, this is how you go and ask for help. So I'm aware your roles will be sort of, I guess you'll only see women up until a certain point after they give birth, or after they, I don't know if anyone's bereavement midwife and how long you can see people for, but I know it will differ from service to service. So knowing that if you can only see them for a month, their difficulties might start to manifest in 2, 3, 4 months. Can you tell them where to go and what signs they might need to look out for? I think the key thing is just not to be scared to have those conversations. I did have a video on here, but I don't know if it will work.
Oh look, Dave from accounts is back at work. He's been off for ages with some kind of mental illness. That's an awkward one. Should I say anything? I don't know how I react.
All right, Dave. Good to see you back, mate. How are you feeling?
How am I feeling?
Hang on, just got to take this call.
Hi, yeah! Got some idiot here who's just asked me how I'm feeling!
How am I feeling?
How am I feeling?
Sorry, I'm just off home because I'm a bit late for dinner. Okay. See you later.
How am I feeling? Pretty good, thanks. Yeah.
Good days and bad days, but yeah, glad to be back at work. Cheers for asking.
No worries.
How are things with you?
Yeah, great, can't complain.
Yeah.
Been busy as always.
And whilst that's not obviously kind of about your setting and talking to women, but I think it's just I love that video because I think it really captures that sense of please do talk about it, please ask those questions, and don't be afraid to probe a bit more because, maybe we will say, oh yeah, we're doing okay, but you might just have that gut feeling that I don't know if you are okay, and just to ask a little bit more and probe a little bit more. Might be the thing that tips the balance and gets people to recognise actually I'm not okay and I do need some help. I just added this in because I love this photo, but this is Michelle, my midwife, and she supported me through both pregnancies, and I have to say having someone kind of by your side who will check in with you and ask you how you're doing, she kept me sane for all the time I was working with her, all the time she was working with me. And obviously it's there's nothing that she could have done differently that would have made me not go on to struggle with my mental health, but I think she kept me sane. I did not lose my shit when I was being looked after by her. It was just when she left that I did. So yeah, everyone be the Michelle that you can be. Thank you very much.